Good afternoon, everyone. Thank you for joining us for today's webinar on building a diverse workforce from the ground up. And thank you for those of you who are adding your name in the chat feature. If you would continue to do so, that would be great. Thank you. This discussion is part of the Pacific Southwest Mental Health Technology Transfer Center, or the MHTTC. The MHTTC is a collaborative effort funded by the Substance Abuse and Mental Health Services Administration, or SAMHSA, to support resource development and dissemination, training and technical assistance, and workforce development for the mental health field. We serve the region that includes Arizona, California, Hawaii, Nevada, and all of the U.S. Pacific Islands. As you can see in this map, each area of the U.S. is affiliated with a region that includes technology transfer centers supporting the workforce for addiction, prevention, and mental health. Our role: we offer a collaborative MHTTC model to provide responsive training and technical assistance that meets the need and priorities of the mental health workforce. We are very interested in your input and welcome your input today and on an ongoing basis in the work that we do. As you can see, our goal is to promote evidence-based, culturally appropriate mental health prevention, treatment, and recovery strategies so that providers and practitioners can start, strengthen, and sustain them effectively. We offer a variety of training at no cost, technical assistance, and resources. You can access information about today's topics as well as previous topics, such as the one around integration of cultural and linguistic competence in terms of leading from wherever you are, as well as other training opportunities on our webpage. Today, I'd like to introduce our team. My name is Suganya Sakalingam, and I am a Senior Technology Transfer Specialist with the MHTTC. I'm also founding partner of Change Matrix with two other partners, and we work with CARS on the MHTTC. My background is in public health and nutrition, and I've served on a variety of capacities in this arena. And currently, I focus on diversity, equity, and inclusion work, addressing disparities, integrating cultural and linguistic competence, and leadership development for systems change. I'm going to ask Naomi to share a little bit about herself, and then she's going to introduce the objectives for today's session.
Thank you, Suganya. I'm Naomi Ortega-Teen, and I work with Suganya at Change Matrix as a change specialist and as a knowledge transfer specialist with MHTTC. My background is in maternal and child health and in immigrant and community health, and I also have a few years of direct service experience at a community health center working with farm workers and community members as well. The direct service piece is very close to my heart. The learning objectives for today are to learn what workforce diversity is and why it's important, and we also hope to hear from you about why you think it's important, to identify how to assess workforce diversity, and to explore aspects to assess of key performance areas that are related to workforce diversity. The MHTTC, some of you may know, recently developed a self-assessment instrument to help mental health organizations in Region 9 assess where they are, where you are as an organization with workforce diversity, and how well positioned they are to successfully implement workforce diversity strategies. It is called Assessing Workforce Diversity, a Tool for Mental Health Organizations on the Path to Health Equity. Today, we're going to be doing a high-level outline of the process for exploring workforce diversity, and we'll outline these key performance areas. We want to do a little plug now to really encourage you to join the communities of practice, which will start next month. And today is a high-level outline, but during these communities of practice, we'll really be diving deeper and going into more detail, and we encourage you to join because you'll get a lot out of it. And so will we. Our agenda, as you can see, will guide us through the objectives that I just outlined. We want to find a way to make this as practical for you as possible so that you're able to start thinking about how you can apply some of these ideas in your work, or at least being a little bit more aware of some of these areas and some of the assessment that you can do as you go about your work. So before we dive into this overview about how to assess workforce diversity, let's just take a minute to define some of the terms that we'll talk about and talk about why this is even important enough for us to gather you all and ourselves here today. We wanted to ask you, why do you think building a diverse workforce is important, especially in behavioral health or mental health? Write your responses into the chat. I see a couple of people typing. Yes, so it's important for the workforce to match the individuals who are accessing the services. You're serving diverse members, so you want to have a diverse workforce to be able to reflect the service population. Great. You can continue typing in as we're talking, and I am going to turn it over to Suganya now to talk a little bit more about what workforce diversity is.
When we have a discussion such as this, it's always good for us to have some shared understanding of the terms and of the concepts that we want to discuss. So we thought it would be very useful for us to share with you our definition that we will be using for this conversation. Essentially, what we would like to do is have you think about the title of our session, and it is called Building a Diverse Workforce from the Bottom Up. And in essence, what that means is that we all have a role to play in this, and that we all need to take responsibility for understanding and being responsive to our own culture and the culture of those around us as we make a commitment to the long-term process of learning and understanding about the value of workforce diversity. What it is, when we think about workforce diversity, what we need to take into consideration is that all of us need to be thinking about it, and the concept of diversity has to be across all levels of the organization and all roles and responsibilities within the organization, not just those of the clinicians in a healthcare environment. It needs to also be considerate of the fact that diversity is much more than race and ethnicity, and that we need to take into consideration other cultural factors that influence diversity. And we also need to think about the fact that how we inform diversity is through our lived experiences, and that we need to sort of broaden our understanding in terms of recognizing the wide range of backgrounds and beliefs and lifestyles and perspectives that come into play as we are thinking about a diverse workforce. So why is this important? Why is behavioral health workforce diversity important? One of the things we know is that the US demographics is changing with an increase in racially, ethnically, and culturally diverse and linguistically diverse populations in the United States. What we also know is that there are differences across cultures in terms of their beliefs and perceptions of illness, wellness, disease, and even the concept around mental health and behavioral health. What we know is that these differences in the culture then informs how people understand a disease, how people understand and recognize what causes the disease, and then what it is that they need to do about taking care of themselves. It also needs to take into consideration people's experiences of these health services and supports, and the biases and the prejudices that they might have experienced, because that too informs the way they experience the healthcare system and the workforce. So generally, one of the things that we really need to take into consideration is the fact that if we diversify our workforce, there is more likelihood that the people who come to access services and utilize the services are going to feel more comfortable in our environments. Why else do we want to be thinking about workforce diversity? Increasingly, because of the US demographics and the shifts and the changes in populations, there are many more regulations and mandates that require us to provide culturally and linguistically competent care. And in fact, the Department of Health has developed a series of standards called the culturally and linguistically appropriate standards to ensure that people are provided services that are appropriate for them. And the more diverse our workforce is, and the more understanding of diverse cultures, the easier it is for our organizations to meet those mandates, to also stay competitive as providers, and also to recognize and understand issues of culture that can reduce the likelihood of liability. And this can feel so technical and academic, and I really want to bring it home to you why this is so important. And I want to share with you a story that has been told and has been recorded, and that makes this imperative that we really think about workforce diversity. One of the most famous or infamous case is that of 18-year-old William Ramirez. He arrived at the South Florida hospital unconscious after suddenly developing a splitting headache at a school event. Before collapsing, he told his girlfriend, who spoke limited English, "Me siento intoxicado." When the ambulance arrived, she repeated "intoxicado" to the paramedics, who, as minimal Spanish speakers, misinterpreted this as intoxicated. They brought him to the emergency department where he was treated for a drug overdose. Ramirez woke up paralyzed. Turns out he had a brain hemorrhage, which left him a quadriplegic for life. The bleeding was overlooked until too late. After being in a coma for 48 hours, doctors ordered a CT scan, which then revealed that his head was flooded with blood. Apparently, feeling intoxicado can also mean sick to the stomach, which is a symptom of brain aneurysm. This miscommunication led to a $71 million malpractice lawsuit. So it really pays to pay attention to workforce diversity.
And I just want to add to that, Suganya, to drive it home in something really relevant to mental health and behavioral health. And there's so many different terms that people use to describe what they're feeling or what they attribute the cause to. And it's very easy to just take that word or phrase that somebody's using that might not really sound like it's related to mental health. It might be about the moon or about temperature, but they're really talking about what they're experiencing, and they might really be having a crisis episode that needs attention. And that's another reason why it's particularly important to have a diverse workforce. How do we assess workforce diversity? What is the process? What are some of the things that we need to do this? And how do we get started? So it's definitely a very important endeavor, but it's equally important to think carefully and prepare carefully before you dive in, because it does take time, it does take commitment, it does take resources. And it's important to make sure that you've really created that climate, that safe and open climate to do an organizational assessment. And I just want to remind us that we're just providing this overview, and these are just a few of the things that you'll want to consider. So the first step is to make the decision and make the commitment. There's a lot of work that can be involved in this, but once you make that commitment, it's good to just pause and recognize that you're already taking the first step to something that is really important and, as we just mentioned, can make a difference in people's lives. So once you've made that commitment, it's also important to really think about who to involve. It's a shared responsibility of leadership and human resources, and as Suganya mentioned earlier, it's not just a leadership or just a human resources issue. It doesn't just pertain to clinicians. It's really, while the emphasis may fall in certain areas, it's really important to think about involving the organization and a cross-section of the organization. What else do we need? We need to think about time. We mentioned that earlier, but if you're trying to kind of squeeze this into a 45-minute meeting and people are running in and out and seeing patients or have a program to run, it may not be as effective. So really carving out that time, it might even mean closing your doors for, for part of a day or coming in on a weekend, or maybe even allocating additional resources so that you can pay people extra to come in when they're not even scheduled to work. Also, making sure to have the tool and a process for doing the assessment. And as I mentioned, the MHTTC, we have this tool that has been designed specifically for you. So now that you have made the commitment and you've allocated the time, you've thought about who to include, you're thinking about a cross-section of people in maybe different areas of your organization. So now you can get started in several different ways, but one thing to consider is to pause and do a self-assessment first, to think about your own individual culture and what you're bringing into this conversation and what your perspective is. So once you've done that, then you're ready to do the organizational self-assessment. And you can do this a few different ways. You can have each person who you've brought together complete it on their own and then come back and talk about it, or you can do it as a group. I just also want to add that we mentioned earlier, this can seem very overwhelming. And you don't have to feel, Suganya is going to go through these organizational performance areas, and you don't have to feel like you have to tackle everything at one time. That said, it's a good idea to be able to look at and know what your areas are that you're going to assess. So Suganya?
Before I go into the performance areas, I just want to acknowledge Johanna and Bill. And Johanna says it's important for the workforce to match the individuals accessing services. I absolutely agree that it is wonderful to be able to do that. We often talk about provider-client congruence. And one of the things to recognize is that is important. And at the same time, just looking at the provider-client congruence is not the only aspect that we need to pay attention to. We also need to see if they're culturally competent, and if they have the capacity to communicate and connect in a meaningful way. Sometimes people think just because you have certain groups of a certain cultural group, if you hire people of the same cultural group, then you're doing well. But there are other factors that come into play. It is the academic attainment of the providers and the clients. It is their socioeconomic status. It is religion. It is values and beliefs that might be different between the provider and the client, even though they come from the same cultural group or racial ethnic group. So yes, that congruence is really critical, but there are other aspects to think about as well. And Bill, congratulations. I think that it's wonderful that you have diverse membership within your organization. And that it's true, when you have the diverse members within your organization, it really increases the richness of the perspectives and the opportunities that the organization have of serving in a way that is meaningful to its clients. One of the things I wanted to explore in this next piece of our conversation is these areas that we want to focus on as we think about workforce diversity. What we do know is that workforce diversity is more than just hiring and training. It really impacts many different aspects of the organization. And while there are certain common elements, no two organizations look exactly alike. So you will have different service populations and different needs. And even if you work with same populations, your staff makeup and your organizational culture and approach may be very different. And so the staff interaction, the program implementation, working with the community might differ. So organizational culture and workforce diversity are to some degrees like different personalities, and we need to pay attention to that. So what are these performance areas that we might want to pay attention to? Here we have passed out 6 different areas in which we could be paying attention to as we look at developing our workforce and diversifying our workforce. One is leadership and governance that will allow us to provide the right direction and oversight, a recruitment that will ensure an effective workforce, onboarding, orientation, and ongoing training, which will ensure that we have taken the time to create a workforce that is responsive to the needs of the clientele. Retention and professional development, again, on an ongoing basis, you want to be able to continue to support the organization. Communication to ensure that information is accessible and available to not only the organization and the staff within the organization, but also to the clientele and to the community. And lastly, around partnership and community engagement, which really looks at the stakeholders, our diverse stakeholders, and what they can bring to support the work we do around diversifying our workforce. Naomi has mentioned it. This is just a 1 hour presentation of a document that we created. And if you have not seen the document, please be sure to go to our website and locate the document, because the document gives more information. But we also want this to be a starting point for the communities of practice over the next 4 months, where during every session, for 4 sessions, be able to address each one of this in greater detail. But for now, let me explore a couple of these with you, and then Naomi is going to explore a few more. So the first one is leadership and governance. And one of the things that we know is that a fully committed leadership and governance body ensures that workforce diversity is a guiding philosophy of the organization. Strategies to support workforce diversity are integrated throughout all levels of the organization and are infused in all aspects of the organization's functioning, such as the needs assessment, the planning for new initiatives, policy development, decision making, and program implementation. An important area to incorporate in workforce diversity is the diversity in the leadership itself. This sets the tone for the organization, wherein staff and potential new hires from minority groups can see more potential for upward mobility because they see that diversity within their leaders. Another important aspect of leadership and governance is the board. If you have a board within your organization, then it is important to note the diversity of board members. You need to be able to include diversity from a perspective of consumers and community members, and this gives you an opportunity to truly reflect the population you are serving. The next area of focus would be the recruitment process itself. And what we want to be able to do is to find and hire diverse, qualified candidates in an inclusive, culturally appropriate manner in terms of ensuring that it includes diversity at all levels of the organization. And one of the things that we think about oftentimes is that we think of diversity when we think about we need providers who are communicating with the clientele, with our populations, to be able to be seen as culturally diverse and maybe linguistically diverse. It is also telling of an organization when that diversity extends beyond just the folks who are providing services in an external way. It is also critical for the community to note that people who are in the back end of the organization, they are in the business offices, they are in the finance offices. They are not often seen as the face of the organization, but there too, diversity has been considered, and it has allowed for a very creative and inclusive way of hiring folks. And so one of the things that you really want to look at is how do we do this recruitment? And one of the things that we will do in the community of practice is to go into greater detail in all the different ways that we can ensure that the recruitment process allows us to create the most diverse workforce. A third aspect is the onboarding, orientation, and ongoing training. One of the things that it has often been said is like, oh, we hire diverse staff, but they don't stay too long. It's oftentimes because the organizational culture and the organizational climate hasn't really taken into account the diversity among the staff and appropriately addresses that. And that is why it's so important that there be an onboarding and orientation process that really allows new hires to get to know the organization, to get to understand the culture of the organization, and to create a climate that is inclusive, that is open, that is respectful. One of the things that we have noted too is an organization that is successful is one in which there is continuous training and ongoing training around issues related to diversity, so that everybody has the same understanding about the needs of a diverse organization and the values and the benefits of being a diverse organization. There are things that we can think about. For instance, does your organization have cultural training or orientation about the different populations you serve? Does the organization bring in community members from those cultures to participate in the training so that people get a true understanding of the diverse populations in your community? When there are videos and training workshops, is the training, the information that's shared in the training, the materials that's shared in the training, are they culturally and linguistically relevant? Are they appropriate? Are we using the right images, the right graphics, the right case vignettes? Are there case studies that really explore the diversity of the community of the organization you're serving? And one of the things that happens oftentimes is people feel somewhat alienated if they don't understand the culture and climate of the organization. Is time taken in the onboarding process of having maybe a mentor that they could shadow for a month so that they learn the in and outs of the organization, and that allows for this transition process to be less harsh. And so these are some of the ways in which we can be thinking about the onboarding, orientation, and ongoing training process. I'm going to turn it over to Naomi now.
Thank you, Suganya. Similar to the onboarding and ongoing training and really setting people up for success, now once we've got them and they're in place, we want to find a way to keep them and to make sure that they are constantly learning and adapting. Professional development opportunities can ensure that staff see pathways for growth and for promotion and for enhanced job satisfaction. And those are some of the things that can lead to retaining qualified and diverse staff. So some of these are things that, Suganya, all these areas overlap a little bit. So some of these things you've heard a little bit about, but they're really, you can't hear enough about them really. They're so important. Creating a climate of transparency, a climate that fosters diversity and inclusion. And this one's really important, where staff feel valued and where they feel supported, where they feel like if they run into a difficult situation or something happens with the population they're serving, either they need more information or they're trying to find ways of relating better, that they feel that the organization that they're with, the leadership, their fellow staff members, really have their back, as it were, and that there's an expectation not just that staff members and providers treat community members with respect, but that there's an expectation set up that works the other way, that there's really a statement, a value that everybody is treating each other with respect. So Suganya talked a little bit about training and making sure that vignettes and case studies have examples that not only people can see themselves in, but that also relate to the service population. So that culturally relevant professional development is really important. If community members, for example, visit natural healers, and I've actually seen this happen where the program and a lot of their participants, their program participants, were visiting natural healers. And rather than continuing to say, well, that's great, but we want you to do it the way that we're talking about, they said, you know what, let's embrace this. Let's bring in one of the natural healers to work with our staff and train them and talk about their beliefs and what they're doing with community members when they meet. You can also find ways of
joining forces. And if there is some sort of a program in the community, a cultural program, you can bring it into your organization. And there are just so many opportunities to provide culturally appropriate and relevant professional development. So communication is another one of the performance areas and these areas where you can do assessment. So this really is talking about not just what language are you using to communicate with participants or community members, but it's broader. It talks about how you communicate and do you communicate your mission, the values of your organization, what your policies and your procedures are. And this is not just with your staff, but really being transparent and sharing this with the community. Communicating your organization's commitment to equity and to cultural and linguistic competence. So some other examples of things that you might want to look at here are your policies and procedures about communication, translation and interpretation. Not only do you have that in place and are you doing it, but are you doing an assessment? Are you really finding out, are we providing what's needed? Maybe there's new populations coming to your community and you may need to think about new services. Also, when you're thinking about the messaging that you're sharing with the community or with your participants or your patients about mental health, are you using culturally appropriate messaging so that you're speaking across cultures and also using non-stigmatizing language? And that can take some research and some training to do that. So another area which Suganya mentioned and outlined a little bit earlier is partnership and community engagement. So here we would encourage you to think about, does our organization have a relationship with partners, vendors, and the community that support and promote equity, diversity, and inclusion to strengthen the organization's capacity and commitment to diversity? And when I say vendors, even that's important. Who you're doing business with, that really can say a lot to your community members. You can, really being intentional in this area can help you attract a more diverse workforce and retain that workforce and help them feel welcome. And just help everybody feel that they're valued. So a couple of the sample areas or elements here are knowing your changing demographics, really keeping up on who's in your community and who you're providing services to or who you want to provide services to. Fostering relationships with culturally diverse partners and vendors, as I mentioned, and really thinking about, again, looking in all different areas of your organization and your programs and the kinds of partners that you are building relationships with. And building capacity within the community to support organizational diversity. So Suganya talked about mentoring staff within your organization. What about internships? Inviting, maybe it's students or maybe it's early career professionals to come into your organization and get some experience with your service population. So those are the areas that we outlined earlier, and I'm going to turn it back to you, Suganya.
One of the things that we need to think about is, where are we in this assessment once we've done that process? It isn't really as simple in terms of we are extremely good in one area and maybe we need to focus and pay attention in another area. It just could be that even within one focus area, there might be things we do extremely well and other things that we don't do as well. Therefore, the assessment will allow us to really map out areas in which we have strengths, and that is something that we want to continue to build on because that really energizes us and energizes our organization. And then we want to look at areas where we think it needs more attention, and we also want to focus in and take the time and the effort to address the issues that do need to get addressed. You may not be able to do everything all at once, and the idea is not to do everything immediately, but to identify and then prioritize the areas that you would like to focus on and to take them a step at a time so that you are able to actually take the time to plan the change. You're able to implement that change. You're able to then assess whether the changes you've made are working for you. And then if you need to make any adjustments, you'll be able to make those adjustments so that ultimately the changes that you're creating will be the ones that you want to hold on to and that you want to institutionalize within your organization. The one thing to recognize is that workforce diversity is not something you take on today and say, yes, it's done. It's an ongoing process. Your community is constantly evolving, and your organization has to continuously evolve with this. But having a plan in place, having a process in place, and knowing that the changes that you want to make can make a difference in terms of how effectively you have undertaken workforce diversity work in your organization. So at this point, what I'd like to do is sort of open it up and ask if anyone has any questions or any comments. I notice that people are typing in some questions. That is great. One of the things that people often ask is when we have very, very small population groups and we are trying to increase the diversity, how do we go about identifying who to recruit? And I think one of the things that this is where your stakeholder engagement and your community engagement is really important. If you can bring in a group of people who can provide advice and provide ideas about how to engage and identify diverse representatives from the community who would want to work in the organization, you will really benefit from that involvement.
And Suganya, sometimes it's also a matter of rethinking the kind of staffing that you might need. It might be that you have a great pool of candidates that aren't necessarily for the position that you're thinking of or the type of program. So it's also a matter of matching your programming to the needs of the community sometimes.
Yes. We have something from Kelly here, and let me read this. Thank you for these reflections and information. What are you suggesting here could have the potential to significantly change an organization? There's a loss going to be experienced, and not everyone will be thrilled with the new version of the organization. How do you suggest the onboard process for this to bring compassion for people who are involved? What a wonderful question, and such a thoughtful question, Kelly. I think one of the things that people worry about when we say we need to diversify the workforce, people do within the organization get worried about their own positions and their own job responsibilities and whether they would be losing their jobs because they're not the right culture or the right race or ethnicity. And I think an organization that does this sensitively and sensibly will integrate all of these conversations into an initial phase of actually bringing up this conversation within the organization and asking for feedback and thoughts about what existing members of the organization feel about diversifying. And the notion is not to fire people or to get rid of people, but the notion is to slowly build diversity into the organization when there are new hires that need to be made. And yes, this will change the face of the organization. But one of the things that we can communicate is the excitement and the potential for doing some amazing things when we have this diverse organization. So much of this is how we communicate this information to our organizations. I think, unfortunately, one of the things that does get lost is this process of internal communication as well as external communication. A good leadership that is thoughtful will take that into account and prepare the organization for this change.
I just want to add, that is such a great question, and your response was really comprehensive. And I think that's why we also talked earlier about the importance of the preparation, the time, and also recognizing that sometimes there may be some difficult conversations. And I think that's also where it's important if the leadership isn't necessarily either comfortable enough to have those conversations or maybe prepared, or just really wants to be able to actively participate and not be the one necessarily kind of facilitating these dialogues, this is where it can also be a great idea to bring in a facilitator to help with those dynamics, and so that everybody in the organization or everybody who's involved really can be actively involved, really speaking with each other.
I'm noting the time, and I'm thinking let's move on to share a little bit about the community of practice, so that this might be the kinds of opportunities for deep questions like the one Kelly has posed to be addressed. And so, Naomi, do you want to share with them what the communities of practices are?
Sure, I would love to. The nice thing is that we'll have an opportunity for the participants in the community of practice to talk with each other and to share ideas and to brainstorm, and hopefully to have an opportunity to actually go and practice some of the things that we're talking about. We'll focus on many of the same, well, really the same topics that we talked about today. Since there were 6 areas we talked about, and there will be 4 communities of practice, we'll be combining a little bit of that. But basically, we are actually going to be doing 2 sets of communities of practice. One will be a follow-up to the webinar we did last week on a similar topic, but on integrating cultural and linguistic competence into your organization and leading from where you are. Those communities of practice will be the second Wednesday of each month for an hour and a half, and it'll be one each month from May through August. And then this set of communities of practice, which will follow what we outlined today, will be the 4th Wednesday of each month for an hour and a half each time. So you can actually participate in both of them if you'd like. Why would you want to participate in the communities of practice? We've already talked a little bit about this, but just to really kind of drive the point home, it's a great opportunity to be able to talk with your peers, to be able to dig a little deeper in these topics. We have thoughts about what we'd like to bring to you to talk about, but it's really an opportunity for you to also raise what is important to you and where you have questions. What we have found is that when people join communities of practice, they really do enjoy those opportunities to practice something in between and to sort of be given a suggestion and then to come back together and say, okay, how was that experience? So we'll have those opportunities as well, and we'll invite you to come on each of those 1.5-hour calls to come back and share and reflect on what you were able to practice. So before we get to the closing, Suganya, I just wanted to see if you had anything you wanted to add about the communities of practice or what we'll cover.
I think one of the intention is to be able to actually put to practice what we learned. When we envisioned these series of events, we first developed the documents, and both the integration of cultural and linguistic competence into the organization and the workforce diversity were initiated by the creation of 2 different documents. And then we decided that it would be very helpful to have a webinar to explore these documents on a one-on-one with all of you, just to get you to begin to think about the document and the information that was conveyed through those documents. And the third event then was to actually dig deeper into the contents of those documents and to really learn what the integration of cultural and linguistic competence would look like and the leadership that it would take to make it happen, to learn about the different strategies and to identify ways in which you can do that within your organization. Likewise, for workforce diversity, there'll be questions that we will explore that would allow you to think about, okay, what kind of leadership and governance do I need in my organization? What kind of communication is going to be important to ensure that workforce diversity occurs? How do I engage my community? How do I engage stakeholders? So those are some of the conversations that we'll be having during those communities of practice sessions. So in closing, what I would like to share with you is that this webinar has been recorded and will be accessible to you through our webpage. One of the reasons why there is a delay is we have to ensure 508 compliance, so we need to be able to have the time in order to make that happen. If you would like to learn more about the topics we've covered, please reach out to us at the Pacific Southwest Mental Health Technology Transfer Center, and you have the information here. You have our contact information, and so you'll be able to connect with us. We also really want to learn from you what it is that you would like to learn more about and the topics that would be of interest to you. So if you were to go to the SurveyMonkey, a survey that we have around the MHTTC needs assessment, that would be also very useful, and that will allow us to meet your needs as they arise. And of course, we are hoping that you will join us and subscribe to our newsletter. What I would like to say is, in the last few minutes, I really want to ensure that you will stay with us through the end and you will complete the evaluation. Our ability to continue offering no-cost training and technical assistance depends on the feedback that you provide us for each of these sessions, and that information can only be provided by you. So the form that we are required to use by our funder is quick and easy to complete, and it will appear on your screen after you exit the session. They did make it a little tricky because initially they created that form for addiction services, and they are planning to create a new version for mental health, but they haven't yet done it. So bear with us. We hope to get that soon. It is really important for us that we have your feedback. It means that the more feedback we receive, the more we are able to improve our offerings and provide you with information at no cost, because the TA Center is supported by the federal government. It only takes a few minutes, so please bear with us and please make sure you complete that feedback. Thank you. We really appreciate the time that you've given us today, and we hope that this has been a useful session for you. And we really hope that you will register and join us for the Communities of Practice, because I think we will have some great conversations through peer-to-peer participation and an opportunity to learn from each other. So thank you so very much.
Yes, thank you so much.